how to ask and get the help you need before you even know you need it. And so I want to tell a story. I am actually wearing a shirt from Nashville. It's been 4 weeks ago, which I can't even believe that conference started 4 weeks ago and that amount of time has passed by. It feels like it has flown. And I want to talk about one of the biggest takeaways that I had and how it relates to asking for help. I was talking to two therapists there. It was a conference for therapists, so that's of no surprise. And they had shared with me, some of the support that they had outside of their practice, right? And how they were able, like as a group practice owner, really to get a lot done. And I realized while my practice had a lot of support and a lot of help, in my personal life, I didn't have a lot of support and a lot of help outside of my husband, who is a great support and help with our baby. And I was trying to run the practice from behind the scenes, manage him, and, have my own little life that I enjoy, like doing yoga and reading and having my little hobbies that I do. And I realized, like, in talking to other therapists, other parents, other group practice owners, while again, the group practice was I have set it up to have a lot of support there. I realized I needed support in another part of my life. So I came home with this, excitement, and we have found some, summer help. And they're actually here right now helping me with our baby, who is a toddler now. I should move on to him being a toddler so that I can do what I need to do for my practice while somebody else is helping, and I can move forward projects without, being torn between two things. And so when I often do consulting with people who are looking to start a group practice, I find a lapse between they want to grow, but they don't want to increase expenses, for instance. So they want more intakes, but they don't have somebody full-time on the phones. That's usually one of my first questions is like, who's answering your phones? How often are the phones being answered? How often are those calls being returned? Like, do you have the capacity and the help you need in order to grow your practice, right? You want to grow your practice, but do you have an infrastructure and do you have support that you need? Do you have, again, if you accept insurance, somebody verifying benefits, billing for you? Do you have somebody cleaning up old claims or collecting balances? Even if you are a private pay practice, it's important for somebody just to review your billing, every month or so, even every 3 months, to make sure like you don't have like these outliers of people who maybe their credit card got declined and you didn't follow up and you didn't realize they had a balance, right? So who's the person beside you reviewing billing? Who's the person beside you answering your phone? Even if you have a solo practice, you probably don't want to be the person answering your phone. Why? Because you're in session. If you're in session and somebody calls you, guess what that person does? They go to the next person, the next person, the next person, the next person, and then you're 4 or 5 phone calls away. Chances are they may have been able to book during that time. And so it's really important for you to be present with what you are good at. For me to be present with what I'm good at, right? And what we're good at is being clinicians, running businesses, right? And so what kind of help do you need in your practice? I'm going to talk about the kind of help that you can look for. But first, I want to thank our sponsor, TherapyNotes, who is so helpful to me because they help us run our practice so smoothly and so efficiently with their electronic health record. There is a free telehealth option. We run all of our billing through there. We run our credit cards through there. We send paperwork through there. We book appointments. They send reminders for us. It is so simple, so easy to use. I am so grateful for TherapyNotes. So I want you to check them out for your electronic health record needs. A couple of people that you need for your practice at whatever level it is to run smoothly is an accountant. We always talk about having an accountant, somebody to help you review your numbers, give you projections, look at your every year, file your taxes, do your bookkeeping. So have an accountant, somebody to answer your phones. Somebody that can really help you manage the flow of calls that you're getting in. If you are a group practice owner or looking to start a group practice, you want to make sure you have somebody on those phones, full-time, ready to go, answering your phones. Somebody to do billing, review your billing. somebody maybe that can help you do administrative things around the office that you maybe have been doing for a long time, but now you want to pass it over. If you're looking to build a group practice, you want to look at a leadership team, a clinical director, site supervisors. You might want to look at a director of operations, somebody who does business management for you. You might want to look at somebody doing marketing. So there's a lot of different areas that you can get help with. And if your business is settled, do what I did, take an inventory of your personal life and see if you need some help in your personal life, because I can tell you it has made a world of difference. I think I will go downstairs and tell our person helping us a very big thank you for allowing me to do what I need to do in running a successful group practice. I'm here most days of the week answering your questions. I'll see you soon, everybody. Bye.